Hey folks, Dr. Gerstmar from Aspire Natural Health. Hope you're having a fantastic day. Today I wanted to do something slightly different and answer a very common question that we get. There's a good chance you're thinking about it or you have been thinking about it, and that's simply, can I use my HSA card? A lot of us have HSA cards, health savings accounts cards. These are the things that are attached to high deductible insurance plans here in the States. If you're listening to this out of the States, you may be going, what the heck is this about? You could probably cut this one short and move on to the next podcast. But here in the States, HSA cards are a big deal. They're often attached to high deductible plans, and they're basically cards linked to a bank account where you can set aside tax deferred money and use it for medical expenses. Now, it's important to realize that these, like almost everything else, were set up for conventional medicine, the conventional medicine system. And the idea is you go into your doctor's office and you have an appointment, and then you whip out your HSA card and you pay for that appointment. Or you go to the pharmacy to get your prescription drug, and when you're checking out at the counter, you whip out your HSA card and you use it to pay for your medication. It's important to realize that that is what it's designed for. So obviously, when people are coming to us or other doctors who are like us, whether you call us alternative, natural, holistic, whatever the word is that you would like to use, it is completely normal and natural for people to want to use their HSA card. Here's the reality though. Bottom line, we do not recommend that people who come to work with us use their HSA card. And this is tremendously disappointing for people. Well, why? Why not? It's important to recognize that in HSAs, there is a tremendous amount of gray area. It is very poorly defined. In general, you are supposed to use it for quote unquote medical expenses. The problem here is that what a lot of us who are interested in alternative and holistic medicine define as medical expenses is very different from what the lawmakers and quote unquote most people define as medicine. Again, what it is designed for are visits to your regular doctor's office, hospital visits or something similar to that, and going to the pharmacy for prescription medications. What it is not designed for is alternative and holistic care. It's not designed for telemedicine. This is a gray area. It's changing a little bit, but as of right now, late 2019, it is not designed for telemedicine visits where you're talking to a doctor or a health practitioner over the internet or on the phone. It is not designed for getting supplements. It is not designed for any kind of membership plan. It's not designed for, going to the gym. It's not designed for buying healthy foods. It's not designed for many or most of the things that we truly want to use an HSA card for. Now, the reality is what's going to happen. So what can happen is if your HSA account is reviewed by the federal government, they can deem expenses on there not for medical use, that you've used it for something other than medical use, and they can come back and they can fine you for that. Now, the reality, again, right now, late in 2019, is that very, very rarely happens. There's generally very few people that are reviewing these accounts, that are looking, that are checking to see what's going on. But the reality exists that if you use your HSA, obviously for something wildly not medical, or in this case for something that you and I consider medical, but that the regulatory bodies, the people who are reviewing these things, consider to not be medical, which can be things like talking to a doctor over the internet or buying supplements that doctor or health practitioner has specifically recommended for you. All of these things quite possibly could be viewed as not being medical expenses, and then the government, it is possible that they could come back and fine you for using that. So for those very reasons, we do not recommend that people use their HSA accounts for things like the work that we do. It's very disappointing. People, of course, are able to use their accounts for whatever they want, but they need to do so understanding that it is possible that they could come back and get fined. So obviously very disappointing. what we want to see is a change in the collective consciousness that work like we and many other people do is considered just as valid, just as medical as going to your regular doctor's office, going to your pharmacy, or having some other kind of medical procedure done. All right, folks, a little bit complicated. The reality is HSAs, great idea. The idea being we should be able to spend our money wherever we want for the kind of medical care that we want. The reality, the laws are very vague, very unclear, and it's up to the discretion of the people who are viewing it largely whether something is considered medicine or not. Now, obviously, if you're going out and whatever, buying a new car, that's very clearly not using that money for medical purposes. But the reality with many natural, integrative, holistic, complementary, alternative, whatever you'd like to call it, practices and providers is that there is a lot of grayness on whether someone viewing that might consider us as medical or not. If you truly want to be safe, secure, and not have any risk that you could come back and get fined and owe money for money that you spent on your HSA card, we recommend in general not using your HSA except for the conventional medical system. Very disappointing for a lot of people. We totally understand that is the position that we take because we are trying to be good stewards and keep people safe. All right, folks, that is it for today. Have you picked up a copy of my best-selling book? If you haven't, I want to invite you to go on over to www.aspirenaturalhealth.com/book. That's aspirenaturalhealth.com/book. aspirenaturalhealth.com/book. You can pick it up today. It is the result of over 10 years of clinical experience, thousands upon thousands of hours of education and learning, and no joke, hundreds of thousands of dollars spent on learning all of that. I take all that information, boil it down to a simple, profound, and easy format so that you can understand the fundamentals, the principles of what keeps you healthy and what makes you sick. No fancy, complicated jargon, just the things that each of us need to be doing to stay healthy or to get healthy. Pick it up today. We've had people tell us that it has gone a huge, tremendous way towards dispelling confusion, helping people understand how to take control of their health and their life. All right, folks, aspirenaturalhealth.com/book and pick up your copy today. All right, folks, that is it for me today. Till next time, take care.